how are we doing? Hope everyone is okay. So, this series of Tell Me About videos. So the first one that I was going to share today, just these little short videos about things to do with pregnancy and labour and birth, postnatal periods, motherhood too. The first one today is all about something called Diastasis Recti. So these topics have come out of my classes and courses, from hypnobirthing and birth preparation courses, and from my pregnancy yoga. And somebody mentioned this in pregnancy yoga a week or so ago, so I just wanted to do a little video just to tell people more about it. It's something either people might not have heard about, or they've heard about it and they're worried about it. So just to explain simply, quickly, what it is and how that might affect you. So a diastasis recti is a separation of the abdominal muscles, specifically the rectus abdominis, which are two long muscles, two separate muscles that run down the front from kind of the sternum down towards the pelvis, called like your six-pack muscles effectively, at the front, the top layer underneath the skin. And it's a separation where they move apart. So it's not a tear or rip in the muscles, they're already completely separate vertical muscles. There's a sheath of tissue called the linea alba, which holds them together, and it's a stretching, a pulling apart of that tissue when the muscles separate. And this is really common in pregnancy because, of course, your tummy is growing, a baby is growing and expanding and has to go somewhere, and so the muscles move apart, and it's a stretching of the linea alba. So it's really common in pregnancy, happens probably to most people, and then most women, and then it will go back again postnatally. And the problem with the diastasis recti isn't that it happens in pregnancy, it's that once baby's born postnatally, if that doesn't return back to a close distance, and it causes problems with functionality within the core. So it can cause postnatally, sometimes it's what it looks like in your tummy, but the main thing is the function of the whole of the core. So the muscles haven't torn or ripped, they've moved apart. There is exercises that can bring them back together to retrain the muscles and actually some of the deeper layers of muscles. It is supposed to happen in pregnancy to make room for baby, but it's not just exclusively in pregnancy. It can actually, diastasis can happen in men as well as women through other things. So it's a separation of the rectus abdominal muscles. I don't believe there's much you can do to prevent it happening. Some people say, oh, if you do lots of exercise, or if you do too much exercise, or not enough, that will make a difference. And I actually think it's just one of those things that may or may not happen. Certainly if you're expecting twins, personal experience, I have diastasis, I was expecting twins, my tummy got extremely large. If you're carrying a baby that carries big in a certain way, if your frame and torso are quite short, then obviously baby and amniotic fluid and placenta have to go somewhere. They're going to put more force coming forward. But that doesn't mean that they can't be brought back together again postnatally, but you just have to know that they're still apart, and you have to know the right exercises and things to do, because certain things can make it worse and certain things can make it much, much better. So don't fear it, but just know that you might need to seek support postnatally just to check those two vertical strips of muscle have moved back together and there's a good functionality in the core. So, and it's important to know that it's not all just about these two muscles down the front. When we think of our core, we kind of think of a tummy and a six-pack, and we think of sit-ups and crunches and planks and strength here. But all of this area, all around the torso, is full of obviously lots of soft tissue. We don't have many bones in this area. We've got our rib cage, we've got our spine, but to keep us upright, we've got this pressure forces around this soft tissue. So we've got muscles, we've got the rectus abdominis down the front, we've got some transabs, these strapping muscles underneath, we've got obliques, we've got muscles down the back of the body, down the spine, the erector spinae. And then at the top of that cylinder underneath the ribs is our diaphragm, flat muscle going all through the body. And at the bottom of the pelvic outlet, we've got the pelvic floor, and the muscles of the pelvic floor, the hammock there. So all of that cylinder, all around the front, all around the back, the top, the diaphragm and the bottom, all have to work together to put pressure in the right place to not cause pressure coming forward to make that diastasis worse or to stop it from coming back. So it's a full, when you're having rehab for diastasis, it should be looked at as that whole container. The exercise needs to work all the muscles all around the core, and also the top and the bottom, so your pelvic floor function and also your breathing is hugely important. So this is why in mum and baby yoga and postnatal yoga, I will talk a lot of what seems quite simple about breathing and pelvic floor and how your abdominals are working. It is the foundation of all of this, to do with strength and stability, and therefore also affecting how your back is and the strength of your back and your comfort of your back, which again postnatally can be something that has maybe some weakness to it. So bringing all that together, I think, is really important. So thinking about your core as this whole cylinder, and not just thinking working the abdominals is the answer, because it's not. It's working all of it together. It's all a system that works together under tension and forces and pressure, and it's understanding that. So they're all connected, and we've got to get them postnatally, after baby arrives, connected back together. So the muscles have moved apart to expand for baby. We've got to get the connections back to get them to come together. And also when you're doing work and doing things, from lifting a baby, pushing a pushchair, going about your everyday life, that it all comes back to be functional. So that is it functional, and then going forward, all those muscles, the back, the tummy, the abdominals, the obliques, the pelvic floor, the diaphragm, are all firing at the right time. And sometimes that takes a bit of kind of training postnatally to come back. So my recommendation is to always see a specialist in this, a really good women's physio who works specifically with this. And it could be within the NHS, but there's some very good private ones as well who are very forward thinking and who can really help you work out a program which will help you bring those muscles back together. They can assess you and see where the diastasis is, how wide it is, and it can be anywhere from, often concentrated around the tummy button, but it can go above and below, or it can just be one part, and then specific work that can help, small movements often, that can just help bring everything back together. And that can help you then going forward, so you don't have any back problems, pelvic floor problems, either at that point or going on later on in life. So that's when you go through the menopause years in the future, if all that hasn't been sorted out, your pelvic floor and the diastasis, when the hormonal changes, the menopause kick in, that can make it an awful lot worse. So it's really worth getting it checked out. If you think something doesn't feel quite right, if you've heard about a diastasis, if you think you have one, go and see a really good women's physio. And I know at least a couple of really good ones locally that I can recommend, so let me know about that. Hopefully that is helpful. So there's nothing that's wrong, it's not a tear in the muscles, it's very normal in pregnancy, but to have it looked at postnatally to check everything is as it should be, and if it isn't, the exercises are really, really effective. So there we go, diastasis recti. Thanks.